This video is for educational and informational purposes only. The content is based on personal experiences and is not medical advice. Always consult a qualified healthcare professional for personalized medical guidance.
All this is the future. What I'm telling you right now is the future. It's coming like a steamroller through us. It's coming here. It's in the verge of being developed, all of what I'm telling you. It's just that it's not mainstream yet. In 20 years, I'll be part of the planet in all likelihood. I like to see it happen a little bit faster than that. And how wonderful we're doing. Oh, we're doing so wonderful. They said, we have dropped cancer death rates by 33%. But that 33% was the result of the anti-smoking campaign. So they're saying that if we didn't stop smoking, we would have 33% more dead cancer patients today than we were expected to have. So these are all expected deaths, not real deaths. But if you still look at the curve, it's still going up year in and year out. Every year we get more dead bodies, but we can definitely drop that death rate, the dead bodies on the field, very, very significantly. Keep people alive a lot longer, but we're not doing that. Why? Because they think it's a genetic disease. So we keep pounding out these absurd precision medicine, clinical trials on drugs that don't work. More and more people, they're being killed by the drugs that are being given. These immunotherapies have just as much chance of killing you as curing you. I mean, we have not dropped the number of dead people year in and year out. The number of dead people goes up every single year for decades and decades. We're not winning this war on cancer. You want to win the war on cancer, you got to see fewer dead people on the battlefield. That's the way you know you're winning. You're winning because more people are alive and fewer dead bodies are on the battlefield. And we're blowing out the finances of so many people living right on the edge. They can't afford this kind of crazy stuff. This is immoral. What we call this is immorality of the society doing this to other. You have to go gradually, bring your body into this new metabolic state gradually. Then once you're in this metabolic state, now you can come after the tumor cells with hyperbaric oxygen. You can come in with repurposed drugs, and these drugs are not very toxic at all. I mean, they're nothing like chemotherapy and this kind of stuff. So there's a lot of options that we have to move the patient from a state of unhealth to a state of health, and in the meantime, you see that diabetes starts to go away. Oftentimes, many people with cancer have type 2 diabetes. They have other comorbidities, hypertension, high blood pressure. They've got all kinds of other things. And all of those other things start to also come back online in a healthy zone while the cancer cells are being hammered. No, I don't think that's true. I think your body will be the judge of that. And that's something that we're really going to have to come to know. I mean, I love beer. Don't get me wrong. But I don't drink it as much as I would like to drink it. Put it that way. But, beer has a lot of good stuff in there, but I would have to look at my GKI and then say, okay, let me have this, let me have 2 or 3 beers and see what it does to my GKI. And we tested the red wine, dry red wine didn't, we had one of my former students who graduated. He went on a 3-day water only fast and then drank a cup of red Cabernet wine. It didn't do much to his GKI at all. So we haven't gone through the wine, whiskeys, and beers to see what that would do. And again, if it shoots your GKI up, how long does it stay up? Because you can come right back down again, and it might be just a temporary shift out of a healthy zone. And people can know, well, I'm going to have a couple of beers that are going to throw me out of the zone for maybe a day, but the next day I'll be back into the zone. And then you have exercise that works together with the that pulls the glucose right out of your bloodstream because your muscles take it right up. Cardiovascular, weightlifting, all these different things. You can get yourself back into these zones relatively quickly. The problem is you don't have a quantitative meter looking at the meter and saying, I can get back in 24 hours. I'd be back in my healthy zone. That gives you an opportunity to enjoy life. You go to a birthday party, some guy's got a big chocolate cake. You can't be fear-stricken that you're going to drop dead if you have a bite of the cake. You just know it's going to throw you into a red zone for 3 hours, and then it's going to gradually go back to the green zone. Okay, yeah. I can deal with that. Therefore, you have and some people may transition in and out of these zones much easier than other people. The cancer patient, we know that they have to stay in that green zone, the low glucose ketone index, to kill the cancer cells. And then once we are in that zone, then we come in with the parasite medications and these other repurposed drugs to really hammer these tumor cells out of existence without toxicity, which is really interesting. And how long? People say, oh, do I have to stay in this thing for the rest of my natural life? I said, I don't know. That's your choice. You look, if you can't see cancer anymore with MRI, PET scan, or whatever you're doing, and you feel good and you're in, people make adjustments, but it's their will. It's once they have the knowledge, it's up to them what they want to do and how to do it. But they need to have a tool to allow them to do that. And they should work with a knowledgeable physician that will look at their records and guide them in how to get in and out of these zones. So all this is the future. What I'm telling you right now is the future. It's coming. It's coming like a steamroller through us. It's coming here. It's in the verge of being developed. All of what I'm telling you. It's just that it's not mainstream yet. In 20 years, I'll be part of the planet in all likelihood. I like to see it happen a little bit faster than that. Well, that's what the National Cancer Institute shows us. The American Cancer Society. One of their great uses for the society is they log the dead. How many people are dying from all the different cancers, and how wonderful we're doing. Oh, we're doing so wonderful. Because they said, oh, we have dropped cancer death rates by 33%, but that 33% was the result of the anti-smoking campaign. So they're saying that if we didn't stop smoking, we would have 33% more dead cancer patients today than we were expected to have. So these are all expected deaths, not real deaths. But if you still look at the curve, it's still going up year in and year out. Every year we get more dead bodies. People say, oh, but what about relative to the rest of the population, like per 100,000 people? When Nixon declared war on the cancer back in 1971, they call it the war on cancer. When we're in a war, we count dead bodies. We don't say, oh, we lost 40 soldiers per 100,000 population. You don't say things like that. You talk about how many dead bodies you have laying on the battlefield. You take a body count. It's not good to have a large number of dead people every day on the battlefield. We have not dropped the number of dead people year in and year out. The number of dead people goes up every single year for decades and decades. We're not winning this war on cancer. You want to win the war on cancer, you got to see fewer dead people on the battlefield. That's the way you know you're winning. You're winning because more people are alive and fewer dead bodies are on the battlefield. Then it tells you this is the way the AIDS epidemic work. If we remember, AIDS was a lethal disease. It was a death sentence. When you got AIDS back in the late 70s, early 80s, you were a dead person, basically, almost everybody. And then they built the cocktail, the protease cocktail, and dropped the death rate dramatically and very overnight. Reagan said that. I'm not going to run through individual trials like this protein, that one. Put them together in a cocktail and see what happens. It worked. Okay, we can do the same thing with the cancer. We're not doing it for a variety of reasons. I'm not saying we could drop the death rate as dramatically as the AIDS, but we can definitely drop that death rate, the dead bodies on the field, very, very significantly. Keep people alive a lot longer, but we're not doing that. Why? Because they think it's a genetic disease. So we keep pounding out these absurd precision medicine, clinical trials on drugs that don't work. More and more, they're being killed by the drugs that are being given. These immunotherapies have just as much chance of killing you as curing you. I mean, this is nuts. But it'll change. It has to change. People don't want to continue on the path. It's not working. But we also don't want quackery and absurd things thrown into the system as well, because once you get a Wild West system where you turn against the established institutions and throw them under the bus, and then you have all these nut cases coming in. Oh, take that supplement. This is going to cure. Can't take that. And these people have no scientific credibility. They're just out there to make money on the unfortunate situation of somebody else. Those people should be herded away. But This is part of who we are as a people. There's always some scammer out there that wants to do that. And when you hear these I'm telling you, I listen to some of these YouTube guys Oh, they're really convincing. It's unbelievable. You listen to them, you say, wow, I got to try that. That guy really knows what and then you look him up and he's a scam artist. He has never published any scientific papers, never peer reviewed anything. Who the hell is this guy? Challenge him. But people just listen to him because what we call them is pitchmen. They can, pitch sand to Arabs and snow to Eskimos, for Christ's sake. They're really good at doing what they do, but they have no credibility in associated. So we have to be cautious about falling into this kind of a trap. We cannot challenge the credibility of major institutions and throw them all out because there's good people in those institutions. They just have to be their eyes opened, and we have to work very, very slowly and carefully to make sure that what we are proposing is established by clinical trials and outcomes that are favorable to everyone, the patient, the physician, and the industry, whether or not they make money on it. The important issue is whether or not the patient emerges from the treatment better than when they started, with a higher quality of life and an overall improved survival. And that's the evidence. And then we can figure out how to make profits and do this. The people don't mind paying a lot of money for something that works. They'll do anything. If you're going to pay $150,000, $200,000, and you say, well, gee, this is a lot of money. I'm going to be in trouble, but I'll live. Have a better quality of life, and I'll live much longer. I think they will do that. But if you pay $250,000 and you're dead in 6 months, you should get a refund on that. And they pass the cost on to the family members. This is horrific. It's called financial toxicity. We're blowing out the finances of so many people living right on the edge. They can't afford this kind of crazy stuff. This is immoral. What we call this is immorality of the society doing this to other people. Yeah, but you have to know how to do it in a way that's not going to be too uncomfortable. Because, already you're fear-stricken by the diagnosis. And now somebody says, don't eat for a week or 2 weeks. This doesn't sound like something you really want to be comforted. So we're learning slowly how to transition the body from the toxic situation we're in more back to a Paleolithic style. But it has to be done gradually over time. And we're talking about 2-3 weeks. We usually go from when my colleagues are doing this, we wrote a big treatment protocol up for glioblastoma brain cancer, but it can be adapted for all cancers. We try to get the person, look at their blood work and see how many other issues, how many markers are out of balance with respect to metabolic homeostasis. And we try to bring those back into balance and slowly transitioning away from high carbohydrate diets to more lower carbohydrate diets, and use the Glucose Ketone Index calculator as a tool to see how you're gradually going. And even if you're eating carnivore or plants or Mediterranean or whatever, when you stop eating carbs and you're replacing it by salmons or meats or whatever, there is still a resistance on the part of your body. Your body is addicted to that glucose as if it were cocaine or nicotine or something like this. So you do have some resistance, but the resistance is a little bit more tolerable when you're eating food, not starving, but you're eating foods that allow you to have something in your stomach that actually tastes pretty good, as opposed to going cold turkey, which is just going water only fasting before starting. It's brutal, man. Try it. It's not easy. Not easy. Oh, well, you do it 3 or 4 days, all of a sudden you're ready to eat your pet. You're all of a sudden, every time a TV commercial with any kind of a food, man, you're glued to the TV looking at the hamburger. You have to go gradually, bring your body into this new metabolic state gradually. Then once you're in this metabolic state, now you can come after the tumor cells with hyperbaric oxygen. You can come in with repurposed drugs. Yes, I haven't checked ivermectin yet, but a lot of people say it's doing good. We use embendazole, fenbendazole. These are parasite medications. And then people say, oh, see, cancer is a parasite. No. The parasite and the cancer use a common pathway to get energy. So it was found out those parasite medications kill parasites because they target that pathway. Turns out the cancer cells use the same pathway. So when you hit the cancer cell with the parasite medication, you kill them like they were a parasite. But that does not mean the cancer is a parasite. They just share a common pathway. So, and these drugs are not very toxic at all. I mean, they're nothing like chemotherapy and this kind of stuff. So there's a lot of options that we have to move the patient from a state of unhealth to a state of health. And in the meantime, you see the diabetes starts to go away. Oftentimes, many people with cancer have type 2 diabetes. They have other comorbidities, hypertension, high blood pressure. They've got all kinds of other things. And all of those other things start to also come back online in a healthy zone while the cancer cells are being hammered. And you have certain levels of flexibility, like the big paper that just came out about a month ago out of my colleagues in Greece, where they took a bunch of GBM, glioblastoma, deadly brain cancer patient, and put them on a calorie-restricted Mediterranean diet, which was salmon, sardines, olive oil, avocado, and a few things like this. I mean, these guys were living as long as 3 years or longer by just doing that. And the people who didn't want to do that, only one guy survived that long. All the others were dead before that. So clearly, we know this stuff works. And boy, once we polish it up, it's going to be dynamic. And it's not, but you got to do it without causing so much stress on the person. You want that person to feel good about it, not like, oh, I'm caged in this room and I can't eat anything. No. We're working on all angles for this. And, carnivores seem to do better than vegans. It's hard to get down into the GKI with just eating plants, but it can be done. It's not, you can't do it. It's just a little bit more challenging, and we're learning. You have to have, for different cultures, different religions, different ages, all of these come into play when you're trying to move the patient from one metabolic state to another. And all of this, we're learning more and more as we do it. And it's going to be really exciting once we have it all together. And the other thing too is emotional stress. People sit in traffic, as well as I, some of the big cities, Boston here, are you kidding me? New York, Los Angeles, Chicago. People spending hours and hours a day sitting in cars in traffic, getting no light, emotionally upset. If you're, maybe they listen to books on tape or something to reduce stress. But the idea is you're not getting any major exercise sitting in a car in traffic. Many times getting pissed off by some guy cutting you off or doing something. And you're not getting as much light as you could, and exercise. All of these come together. But, that's our society. What are we going to do? I mean, we got millions of people working in these cities and what are you going to do? And the Paleolithic man spent all of his time trying to kill deer and buffalo and elephants and stuff. I mean, he wasn't thinking about his 401k, I mean, if he had anything to eat, he was really lucky to find something. Like, how hard it is to skin a buffalo? Oh, my God. And chopping it all up and digging the marrow out of some elephant's femur. I mean, this is not easy stuff, but that's who we were. Let's go back to Paleolithic time. Listen, nobody wants to go back and, kill deer and skin them and all that. But we have to know that we have to make the transition to be as close as possible with the light, the exercise, the reduced stress, the replacing highly processed foods with more natural foods. And then we have so many folks in society living in these food deserts. They have nothing except the highly processed foods, putting them at risk. And generally, it's the lower socioeconomic people in the society that have to suffer like this. We're doing it to our own people, making these problems. But once you know what to do and how to do it, then you can solve certain of the problems and make things better. But right now, most people are clueless on this and how to do it. When I was in New Haven, Connecticut, at Yale University, some of our neighbors were firefighters, and they would come back from these fires, and their nose would be all black from inhaling all the soot and crap that was in these places, and choking. This is extremely unhealthy environment. Extremely unhealthy. There has to be some way to allow these bodies to get back on track. And especially in New Haven at that time. I mean, it was like every other block there was something burning. It was really tremendous stress on the firefighters at that time. But yes, you guys put yourselves at risk, and therefore your career doesn't last as long as some other careers because your bodies get so beat to hell from being exposed to the toxins, and the stress put you at risk for shortened lifespans, one or another. So if you work as a fireman for 20 years, you deserve a break. Do something else. retire from the fire department, go out and become a farmer, work in the ground. something to give you plenty of light, plenty of sleep. Your body is an incredibly healthy machine if given the opportunity. The problem, we're not giving our bodies enough opportunity to heal and get healthy again before we throw them back into the stressful event. Chronic problems puts pressure on mitochondria, leading to chronic disease, which could be seen as dementia, cardiovascular disease, cancer, type 2 diabetes, hypertension, high blood pressure, all of these, macular degeneration. All of these are linked in one way or another to mitochondrial health. So the glucose ketone index calculator is designed to keep your mitochondria healthy as best you can to delay or prevent these chronic diseases. And that's where our future will be. Yeah, well, the thing of it is, as long as we have new tools, and again, people will be their own judge and jury on this whole thing. As long as they know what to do and how to do it, we have to leave it up to them to do that. No one's going to force anybody to maintain a low glucose ketone index by force. You're not going to do it. It has to come from your own willpower. And there are people who will never bend to that. And they'll never be wanting to do it. But that's okay. That's their personal choice to do that. But as long as we have a tool that allows us to know where we are with respect to our general mitochondrial health, I think there'll be a lot of people that'll be interested, especially when you can get it onto your cell phone and read it in real time. Continuous glucose ketone monitors will be the future. And at any given time, you'll have your calculated GKI looking at you right in the face, and you'll know whether you're a good boy or a bad boy. One of these kinds of things. And then you have to make the decision as to what you want to do. Turbo cancers or something like this. Our metabolic therapy does not discriminate. We're an equal opportunity cancer killer. They can't grow without the fermentation. I don't care what you want to call them, turbo or whatever. But one of the things that's interesting, people need to keep it in mind. Everybody's running out blaming the vaccine. In some cases, that's true. We haven't really ferreted it out. But direct hard evidence that the virus itself, the COVID virus itself, enters into the cell and damages the mitochondria. So that's the virus itself. Now, whether the vaccine is doing the same thing or working synergistically with the virus, we don't know. And like if you take people who've never had COVID and given them the vaccine, who've never had COVID, do they get cancer and do they get mitochondrial damage? I don't know. But I do know from the work of Doug Wallace and others, these are leaders in the mitochondrial metabolic field. They've been showing that the virus itself can damage mitochondria. So we have to be very careful. We have to be careful how we point fingers until we have a full readout, a full readout on this. So we have to just wait for a time to come and then get more and more better information about the virus itself and the various therapies that were given to ameliorate or reduce the risk of whatever the virus was doing. So I know people hate this and hate that, but we got to wait for the research to come out and see what's going on before we start turbo cancers and all these kinds of things. But as I said, if it's cancer, we know how to kill it without toxicity. And once people know how to do that, they don't really care where it came from. If I were to die today, wow, I don't know. If I knew I was going to die, I don't know what. I mean, I don't think two people would be wanting to say much. How's the 401k doing? Who's going to carry the casket? Who's going to start the burning fire? I don't know. I mean, it's really something I really don't know. But we started the ball rolling here, and it's not going to stop rolling because we're on the right path. And what we have is the science to support what we've done. So I think when you have Mother Nature, you have peeled back a part of Mother Nature and exposed certain things that were mysterious. Now you can work in a logical way to improve everything. And it is, I have absolutely no question about it. I'm probably not going to be around to see the ramifications of this, but man, it is so locked into evolutionary biology and biochemistry as we know it today that it's going to happen, because I've seen it already. I've seen the power of what we're talking about. It's just that the rest of society and the industries have not yet, are either willing or understand what we're talking about. They will come, and they're all going to be wanting to be a stampede to get it. And everybody's going to be their own unique person. Be very excited to see. They'll have GKI parties. Let's have a big who can have a big party and who can get the lowest GKI at this party, or even the highest GKI, and see how fast. I mean, it's going to be really exciting, because you're going to be seeing it in real time on your cell phone, and you can track it over time, share it with your caregivers and your health providers and this kind of thing. So you'll know where you are at all times. It'd be very interesting. Paleolithic man. We were so happy to get out of the Paleolithic. I mean, are you kidding me? Who wants to go back and live in a cave and having to kill those animals, and live as a hunter gatherer? It sounds great and wonderful until you actually do it. You say, man, I'm out of here. Give me a Twinkie, will you? It's just putting the parts back together again and just reevaluating everything. Because I like I like a big pizza. I like a beer. I like a hamburger. I'm not going to deprive myself of those things. But if I look at my GKI and I'm saying that burger ain't the one I want, man, okay, we'll have to find another substitute. But that's my choice. Get a lot of exercise, do what you can, make sure the light, yes, get out in the sun. I mean, right here in Massachusetts, I mean, we didn't have sun for damn near a week. Drop dead of vitamin D deficiency. Oh, absolutely. And all that's part of, we're learning about emotional stress and metabolic therapy. So that's a lot of neuropsychiatric problems are the result of of energetic imbalances in the brain. We're trying to bring that back on track as well. Dementia, another, 40 or 50% of dementia is as a result of metabolic imbalances. So all of these things are manageable to a large extent once we have the tools and the knowledge, and then things will start to change. And I'm looking forward to seeing those changes myself. I wrote only one book, Cancer as a Metabolic Disease by John Wiley. There are other books that have my name that I wrote. I didn't write those books. That's one of the sham artists trying to do this kind of stuff. Our research is being driven largely by philanthropy and private foundations. So you'd be surprised the people out there that want to be part of the movement. They want to be part of this change. And they don't really care whether they're going to make money on it, but they want to know that they're participatory in what we know and what we're doing. So when people read my publications on open access, anybody who has access to Google can look my name up and see the papers. And then you go to the acknowledgement section of the paper and you say, who the hell are all these people? Like all these names? Well, these are the guys that are giving us the money to do the research. I said, and some people say, I don't even care if you put your name in the acknowledgement. I just want to be part of this. And some people say, yeah, I really appreciate it. Thank you. So you see all these names there and you say, whoa, these are the guys that are the philanthropists and the people working in the private foundations. So, and that keeps us going. As long as we have that, man, we're going to break the doors down on this whole thing. Because we got new data coming out all the time, new information to help people, new procedures. It's coming. So I'm excited about it. Well, there was a group from BBC that said I was providing misinformation, hazardous. Oh yeah, very, very hazardous. Eat a little bit of fat and do exercise, extremely hazardous to your health. Who are these people? I don't know. Imagine somebody saying that. Oh my God. Yeah, but that was the BBC, and they were brutalized by the people. How insane and stupid what they were saying. As I said, mostly they ignore us. They ignore us until they can't. And when they can't, it'll probably be too late for them because the people will already be behind us. And our papers get some of the highest views now. It's unbelievable. When we publish these papers in top scientific journals, I have a media group of people that send this stuff out to the world. And all of a sudden, people start reading it. They talk about it, and the word starts to get out. They can evaluate the data. They can look at the information. And they can come to their own conclusions. They want to get into this. They want to get into the movement. They can. They call me. Oh, I want to get involved. I want to do this and do that. And I already have groups of folks that bring these guys in. Okay, everybody has a specific talent that can move the field forward, and we use them. And they get excited because they're all participatory on this ground change. the basic groundwork is being done by these people.